right, guys. So welcome back here to Oakbrook Medical Group. The team's going to show you here some low back exercises. So Jose is going to demonstrate a couple different things, starting off with the deadlift. The one thing I do want to say with deadlift is obviously we're going to help strengthen glutes, legs, low back. This is one of those exercises that's very controversial. Some patients can't do this. Some doctors will tell you don't ever do the deadlift. At the end of the day, all you're doing is picking up something from the floor and bringing it up. So we have to do that for the rest of our lives. You're always going to have to pick stuff up. So it is important to do it right, do it correctly, do it properly, however you want to phrase it, to make sure that form is there to get nice and strong. So next he is going to move into one of my personal favorites called farmer's carry. Lots of different ways you can do this. Hey, look, he just did a deadlift. He bent down, picked it up the weights. So farmer's carry, you're holding something, some type of weight in both hands. You can also do this with weight in just one hand. The whole reason is we're going to pick up something heavy and we're going to walk with it. You can kind of see as he's walking, there's a little bit of waddle back and forth. It's all about stability at this point. We're trying to get that low back to fire, keep strong while he's lifting something, while he's moving, so that no matter what he's doing throughout his daily life, that core stays nice and tight, nice and strong, and stabilize that spine to help protect that low back. And like I said, if you really want to, you can just do it with one dumbbell in one hand and then walk, and that's going to make it a lot more challenging. So then we're going to move out here to one of our PT mat tables. Jose is going to go through a couple different exercises here. Again, remember, all of these ones are more advanced. So if we have a patient coming in with like acute pain, they're not going to be going into this right away. So doing the dead bug here, alternating. This one's pretty difficult. So you got to make sure you're keeping that low back pressed into the table. Core stays nice and tight, nice and strong. If you really want to be mean, you can say go slower. Really break it down, and the slower you go, the harder that's going to be. We're going to work on stabilizing. See, he smiled there because he knows that it got a little bit harder. All right, we don't want to make him sweat, though. We can go ahead and move on to that next one there. Oh, Liz, doing a drive-by check. You like that? A little drive-by check. He was unaware that was going to happen. That's pretty good. So then next, Jose is going to go into the Pallof Press. So this one is actually great. This seems like such a simple movement. So the whole purpose is we got tension on that band. So Jose's keeping it right in the center of his sternum, right in the center of the stomach there. And it's more of an anti-rotational is what we're trying to do here. So that band is trying to pull him off to the side. He's trying to keep it nice and stable in there. So his core is going to be engaged that entire time. Obviously, make sure doing this exercises, you're doing it the other direction as well. We never want to overwork one side of the body versus the other. So pushing there, you can see nice straight back, core is engaged, glutes are engaged, everything's upright and in line right there. And then if we really want to make it even more challenging, more advanced, we add a little bit of a chop to it as well. So he's going to go out, up overhead, and then back down and in. So same idea, but when we take those hands up overhead, it's really going to make that core work. So again, advanced exercise. Patients aren't doing this right away, but we want to make sure that they can progress to this before we release them, just to make sure that they are nice and strong and they can do everything that they have to do on their daily activities completely pain-free. So if you guys are interested in these exercises, you have questions, you want to come in, talk to us, see how you can get treated, how we can get you feeling better, call us at that number below, and we look forward to working with you guys soon.